Okay, cool. All protocols observed. Good evening. My name is Michelle Oyobiero from Kenya, and I am the co-founder of Fmile, which is a nonprofit that raises awareness on mental health and suicide. First off, I would like to thank you for joining us today as we discuss matters on autism. Well, autism is spectrum disorder is a condition related to brain development that impacts how a person perceives and socializes with others, causing social interaction and communication problems. The disorder also includes a limited and repetitive patterns of behavior. The spectrum in autism spectrum disorder refers to the wide range of symptoms and severity. This is why we are gathered here today to discuss this. Um, Advocacy for autism allows for individuals within the spectrum to lead healthy lives whereby they feel safe and supported. Us being here is taking a step towards advocacy and acceptance of autism. With it being Autism Awareness Month, Smile deemed it fit to host this webinar. Once more, I would like to express my sincere gratitude to everyone who has joined us today. I would also like to begin by introducing our panelists today. We have with us Ms. Anne Jerry Kamal. We also have with us Professor Joey, James Joey. We also have ourselves with us today, Dr. Maureen Kinye. And we also have Calvin, who is the head of operations at Fmile. Yeah, I think that is it. I don't know if you guys would like to give a more detailed, detailed reason of why you are here and who you are today. Yeah.
Maybe not. I think that's a good introduction. So we could kick off. I can see this is 17 plus 5 or minus 5. 17 plus us. So we have like 12 people. I think we could start. So as we had agreed, we'll give Ms. Njeri Kamau about 15 minutes just to give us an overview of experience of having a child, a family member who has autism, and she'll go through her life experience from diagnosis up to now. Then after that, we shall have the content expert. In fact, much of this talk is about Maureen. It's by Maureen. So she'll give us about 35 to 40 minutes of the content as it is and in a systematic fashion, if you will. Then we shall go into a Q&A session. So anybody who has questions, please email them in, Calvin. They email them to you, or
so the questions you can I think you can easily add questions from like your view. The questions will come to us, yes, and then we can preview them here.
Excellent. So Ms. Njeri, the floor, no, not the floor, the air is yours, Ms. Njeri.
The virtual space. Thanks, Prof. Thank you, and good evening to everyone. Thank you really for having me share my story. I'm very, very honored and delighted to do this. I went back to my house when we talked earlier. I wasn't in my house. I came back after maybe the prep. I just felt that this is a story that I cannot tell without my husband, because the story begins actually as our story. And this story begins on the 24th of August, 2007, which was our wedding day. It was a beautiful day, guys. Beautiful day. Most beautiful day, I think, of my life, and had many hopes, many dreams, and of course, somewhere along the line, children were part of that story, and they still are a part of that story. But I think what we were never prepared for was, children in the way we have experienced, especially our son, William. So 2 years later, 2009, we learned we were pregnant. Of course, happy times. Thankfully, it wasn't I see like the way people do baby showers nowadays and baby reveals, and I'm like, oops, thanks God I navigated that space. Seems like a lot of work, but anyway, I mean, there were exciting times, and I think we were just reflecting together how the best memory we have of that time was going to the going for the scan the first time together, and this person asking us if we wanted to hear the baby's heartbeat, and hearing this sound that sounded like water that was gushing, and we were super excited. And like I see myself, because I started going for my prenatal care in Aga Khan, and I see myself in that room, and we were like, is that the baby's heartbeat? And like there were just good times ahead, really. And so just the usual gyna, the supplements, the Lamaze classes. And again, I think it took me a while to let go of like all those records that I kept, like going to class, the literature I collected. And just again today, as we were reflecting together, like around the Lamaze classes, where we were really being prepared for natural childbirth. And I think maybe at that time I was also very I really had romanticized, when I think about it, natural childbirth, being able to walk in and walk out. And I come from a family of 6 children. I'm the firstborn. So literally I've seen my mother go to hospital and come back with a baby. She's gone through natural childbirth. So I really didn't expect anything different. CS was not really part of my plan that time. But now when I think about it and think about like the gaps that could exist in, for example, maybe preventing certain neurological or conditions that arise because of birth, I think there's a gap there where we never ever anticipated birth complications. We never even thought of birth complications. We never thought that natural childbirth could come with this complication that has, made the guy the way he is today. So maybe Dr. Maureen, that's something for, I don't know, in the medical circle to think about, just how prenatal care or prenatal education should actually involve complications, birth complications that could result in things like CP or in autism. And so Sunday morning, 2009, January 11th, I started laboring at 2 a.m. in the morning. And by 10 a.m. that Sunday, that same morning, it was clear that I needed an emergency CS because I was bleeding heavily. So later on, the doctor said, you are only dilated 2 centimeters from when you started labor. That's a problem, because I started laboring at 2 a.m. And yeah, so they wheeled me into the emergency. And when I woke up, I was, of course, very excited and anxious and eager to see my baby. And again, the first time I saw William, he was in this box with all these tubes around him. And I was thinking, wow, what a big baby this is. Like, he was really big. And he was, later I came to learn, he was in the neonatal intensive care unit, because just after they took him out, he had a seizure, and so he had to be taken into the ICU. But just coming out of hospital and working with this pediatrician, it became clear to us that it dawned on us, or it was continuously made clear to us, that this road will be a bit bumpy, only that we didn't know how bumpy it was going to be. But I think because I'm giving this story, I really, and my husband is here now with me, we really just honor Dr. Hina Dr. Hina Hooker. She was our pediatrician, and I think she started to prepare us. We were first-time parents. It was very shocking, like, what's going on, like, what's happening? We thought it's come, take your baby, go, and here we are. And I think she started to just prepare us that this may not be as easy or as straightforward as we had anticipated as parents. And she referred us, immediately we went back for our first clinic, she referred us to, I'm sure, Prof, you probably know him, Osman Mianji, Dr. Mianji in Aga Khan, and he reviewed the MRIs, and he was the first person who said it very clearly to us that this boy had suffered brain injury at birth, and because of that, we could expect challenges. Again, he didn't tell us immediately what kind of challenges, but I think thinking about him today again, we really appreciated his fatherliness. You know, we were very confused. We were 3 people. I remember it was me, Ambrose, my husband, and our house help. We had really waited for this baby, the 3 of us, very eagerly. And the baby's here, and we are being told this child might not see, this child might not walk. We have to wait and see what they can do, what they can't do. But again, I think he was somebody who really, I think this is the best way I can describe it. He really gave us a heart for our son, because he said to us, if you choose to look at this child as a child like any other, if you choose to accept him the way he is, and like he said to us, I'm already saying to you that there will be things that are complicated, you will be surprised. And he said there was brain injury, but it's not like the whole brain is gone. There's a part of the brain that can still be nurtured, it can still be taken care of, it can still work. And I think that was the first time my husband and I, that time I think we were 29, we left the Aga Khan feeling very hopeful and feeling like we had received a gift, you know, like everyone else had received a gift. So we kept going to the pediatrician, and Dr. Hina she had a doctor they were sharing office with. We're really trying to remember his name. We see his face, but both of us can't remember his name. But on this particular day, he talked to us about, you know, just tell me about the milestones of the baby. He was around 2 years, 8 months. And at that time, he was supposed to have at least 50 words, you know, like speech. He has picked up like speech. And that was the first symptom that something was not right, because he didn't have speech at that time. So he sent us to Gertrude's to see a speech therapist. And the speech therapist was convinced that we should try school first before we can, you know, put him through like speech therapy, because he was still very young. So thankfully, I'm a teacher, and then that time where I was teaching, there was opportunity to take him to school, and we took him to school. And of course, being with other kids, he was still the only child. So being with other kids, of course, there's that excitement of playing and growing. But it is also in school that we started to notice the hyperactivity. We started to notice that unlike other kids, like he needed more hands-on attention. Like he would stray very easily from the rest of the group. You know, if the teacher was not paying attention, or the assistant teacher, like he was the child who needed the teacher to hold their hand all the time. He needed more attention if they wanted him to concentrate. Concentration was a problem. He wouldn't sit for long and be able to like maybe do just tasks that kids are doing like in a play class. It started to become more and more obvious that there's something, you know, the way, you know, like there's something, but we don't know what it is. Around the same time, episodes with seizures increased. So he would we would go to Aga Khan quite often, you know. He would get seizures. Anytime he had flu, a seizure would come, temperature, a seizure. And so it was, yes, and his seizures often were at night. And so at that, when he was sleeping, yeah, and at that time, Dr. Miyaji medicated him, put him on epilim, and I think he just continued to speak to us about, I remember him talking to us about what that means in terms of how long he might have to take it. And he said to us, this is not medication that he starts and stops. This is medication that he's going to take for a long time. He talked to us about the effects of that medication, for example, on, you know, like the kidneys, the liver. And I actually miss him. He was still our neurologist back home when we were in Kenya. And, you know, he would keep saying, like, guys, you know what, there's so many people in the world who are medicated. They live healthy lives. Just like he kept saying, I know sometimes, you know, people of faith, you know, they will reach a place, they say, no, now let's try prayer. Or we have exorcised this demon of epilepsy. We don't need medication again. And I think my husband and I really, really thank Dr. Miyaji, because I think he really, he wasn't just a doctor, he was more than a doctor. I think he also understood that it's a loss. Like, this was not the child we had, or the child we had expected. That, you know, back on the 24th of August, when I was accepting my vows and accepting all the children that God would send me, like, this was not the kind of child that I had in mind, you know. And so he really helped us also to just navigate, ask him questions like, how do we do this? How do we understand this? What does this mean? And so because of that, I think because we believed, and we still believe, that this is a person who has potential, he has ability. It may not be as packaged the way we see it or know it, but he really helped us to believe in this child. When it came to our family, it became very easy, I think, to speak, to be honest with our family and say that, okay, this is what this child has, but he's our child. And I think our family could see that for us, we are not like fighting, or there's no tension. We just loved him and accepted him the way he was. And I think because of that, in the family, he has not suffered stigma. He has not suffered anyone thinking, maybe they think, but they've never made it clear, or they've never shown it, because both me and his father have really just taken it in stride. And I remember one time speaking to my mother and saying, because we come from a Christian family, saying that, I mean, if we accept the good things that God blesses us with, then we should also accept whatever we consider as a suffering, if we really say all things come from him and everything has a reason. So I think because as his parents, we have been such a great support system to each other, and really tried our best to place him and help him and support him. I think in the family, he has also received that kind of support. They don't understand. We see sometimes, and it's taken a lot of talking to them and explaining and saying, no, he's like this. He's 13 now. He's big-bodied, so he may be mistaken for somebody who, like maybe a 15-year-old, but we do know chronologically he's maybe around 10 years old. And so would say, for example, he may not be able to cook an egg, while his cousin, who is 13 years old, is able to cook an egg. So schooling made clear, I think, being the social setting made clear that there was something that needed to be done. I know that his nanny That's also another person. I've written her down in my notes, Regina. I think she was just an ordinary house help, but I think she also really, the way she's the only nanny we've ever had, but she took this child with such seriousness that challenged us as his parents to also take him with such seriousness. Like, she would never allow us to see him as anything less than a child, and she like trained him, potty trained him. She would teach him how to make the bed. Like, she treated him like he was just any other child, and she would never allow us, because William has his body structure. I always tell him he's like me. I'm a very hippie girl, and so he also looks a bit hippie. And so, you know, out like where we were living in Kiambu in Banana, and people would, like, they're going to the market with Regina, and somebody says, "Oh, hi, little girl," and she would get very upset and say, "This is not a girl, this is a boy. Just like use your eyes. This is a boy. There's no girl here." And she like would be very protective of him, and she would say, "Guys, there are so many people who are different in this world, and so we're not going to start showing him that he's different, even though we know that he could be different. He could be a different kind of a person." And so she was also somebody else who, very, I would say ironically, because I would say we're more educated than her, maybe even more knowledgeable than her, but just as an ordinary person, she chose to really look at this child just as a child, not to see his limitation and say, let's help him with what he can do. And so we also took him very seriously. And I know she would take him to school, and she didn't like his first teacher because the teacher was also struggling to understand, you know, this child. Once William comes into class, it's like having 3 kids at the same time. So she would say, "I don't think that teacher is the best teacher for this guy. She seems to have like an attitude," or something like that. But during our visits in Gertrude, that's when we were able to meet Dr. Onala. Dr. Onala is an educational psychologist, and we asked him to assess William. And that was the first time we had autism, you know, and he said he has symptoms of autism. And that was when now I think our greatest struggle, I wouldn't call it a frustration, because I think being a teacher has really, I've become so aware that this child is not a regular learner. And so I have been very conscious of his gaps, even in a regular class. And speaking with Dr. Onala, we got to really understand, you know, like a lot of things, even diet. We had never thought that, oh, you know, you can't just feed this person on starch. You know, starch is activating, you know, it's making him hyper. We learned a lot of things around probiotics, gut, you know, just that whole digestion and how digestion, you know, spikes hyperactivity. It's just been a lot of learning. But one thing that I always knew was that school was hard, and school was difficult for him, because in Kenya, even in the private schools, because I was teaching in a private school, special needs is not yet really understood. I would say that the spectrum is so broad, we just cluster all the kids in one class, especially in primary school, and just have the special needs teachers just figure out what to do with all of them. And so I think for us, that has been our greatest need as far as William is concerned, that we will find a place where, number one, he can grow in understanding himself, in understanding his world, in understanding how to navigate his world, especially socially, because we see, I mean, the world is a cruel place. The world we live in is a very hard place. And so for him to be able to communicate, to be able to say, this is what I want, I don't want this, to be able to come up, for example, to his teachers or to ourselves and say, this happened today in school, I didn't like it or I liked it, has been for us our greatest challenge. And surprisingly today, what just reflecting with his father, we do see that outgrowing some of the symptoms of autism, especially communication. He is now able, he can hold a conversation, you can hold a conversation, you can talk. He is able to make eye contact. He's still a bit edgy on the body, you know, he will be like, please mom, don't hold me, like don't touch me, like don't do that. I don't like that. But socially we see that he is drawn to other children. There's a challenge because he's big-bodied, so they expect him to be thinking in a certain way, but he's not thinking like that. So they get frustrated sometimes. He gets frustrated sometimes. We get frustrated because we don't know how to intervene and help. But we've also learned that we also just have to allow him to grow. We keep talking and saying this is right, this is wrong. Yeah. Calvin, I'm a teacher, I could talk forever, and like I told you guys, it's a long story. I don't know if, I'm sure I've exhausted my 15 minutes.
It was worth it.
Thanks, Prof.
I think that's a very good plan. And it was, I mean, as you're talking, there are so many things going into Dr. Maureen's head, I think. Certainly, I was thinking, just a minute, let me sit back. And so let's have the content expert talk about autism. I'm sure there's a lot of discussion that may come up in terms of the way forward and so on and so forth. So Maureen, maybe you can share your slide, and we'll probably switch off our videos for you. So you could share your slide, Maureen? Maureen is muted. Who is unmuting Maureen? Maureen, we can't hear you.
She muted herself. There she goes.
Calvin, can you override her?
Can you hear me now?
She is mute,
Can you hear
unmuted.
me now? Okay. All right.
Unmuted now, fine. So we'll probably get off here.
All right. As I do that, I hope you can see my screen. Can you?
Yes.
Yes.
All right. Excellent. So as you have heard, my name is Dr. Maureen Kinge. I am a pediatrician, and I am also faculty in the University of Nairobi in the Department of Pediatrics and Child Health. For me, I was really excited to be on this panel because child development is sort of my pet subject. Currently, we only have 3 developmental pediatricians in the country, all in private practice, all in Nairobi. So this is an area where, one, we do not have enough representation of specialists who are able to care for children and young adults like this. And 2, we do not have enough people in the teaching space who are able to teach the people who should be taking care of these children outside of where we have the developmental pediatricians. So it's an area that I became interested in, and I have found myself conducting a lot of research work and teaching myself a lot on how the child's brain develops and how some of these conditions come about. So as I was listening to Jerry talk about William, I was really, I was really happy that she found people who cared about her, who were knowledgeable and who knew how to communicate about the needs of her child.
And I really hope that every parent who has a child with autism spectrum disorders manages to find a space like that. So autism spectrum disorder is a group of disorders essentially, but you concentrate on autism disorder itself because it's the majority. There are other conditions under the autism spectrum disorder. It's a condition that everyone should know about. The number of cases of autism have increased by over 200% as at now since 2000. In the year 2000, the CDC was reporting in the US that they had 1 in 150 children with autism. Currently, in their 2021 report, they reported that 1 in 44 children has autism. We do not have much information about children in the low and middle income countries, and especially sub-Saharan Africa, because of the challenges with diagnosis, identification of these children, and knowledge even among the healthcare space. So it's a condition that is generally overlooked, yet it is a condition that everyone comes across. Generally, you have the male child is 4 times more affected than the female, and it's a condition that affects children in every cultural background. So nobody knows exactly what causes autism, and there's no single thing that has been shown to cause autism, but there are things that we call risk factors that have been shown to contribute to the development of autism. And one of these is abnormalities in the brain structure, like Jerry was talking about. Her child who was born didn't get some oxygen for a little time. The brain got some injury due to not getting enough oxygen. That damage can trigger the cascade that brings about autism disorder. You can have even a child who's been born in a happy, healthy home with no problems during delivery or pregnancy. That is the one we call hereditary autism. So you can have a child who develops autism, and you find that subsequently several siblings after that also have autism. There are some conditions that you can be born with that affect the way your DNA is put together that are associated with autism that we know of. There are other factors in the environment, like exposure to drugs during pregnancy, toxins like mercury and lead, whether in the mother or the child. There are other causes. A lot of research right now is looking at how inflammation contributes to the development of autism. So especially children who have stomach issues, the GI gastrointestinal issues, get prone to getting autism. So all these things come together and essentially cause an immune reaction in the brain, and that affects the way the brain wires itself. So if you think of the brain like an electrical device, has lots of wires. When the child is born, as they are growing in the younger child, you sort of develop many new cords and cables that connect new information, help the brain to learn new things, make associations. For example, that furniture that is in the bedroom that has the mattress is the bed, and that is where I go when I need to sleep. So you start to form new information, and that makes sense, and that helps you to navigate the world around you. And eventually, as the child grows, as you're developing new connections, you also start to sort of cut the cables that have information that no longer is needed, or information that does not make sense, or that complicates the way that you are able to understand things. So that's the process called pruning. So a lot of research has shown that the people who develop autism miss that step of pruning and maintain these many cables. So, for example, if you see a pizza, to you it's pizza. But for a person with autism, they see the bread, they see the cheese, they see the toppings, each one, the olives, the tomatoes, and whatever else is on it. They smell the bread, they smell the cheese, they smell the tomatoes, the olives, and whatever other topping is there. They feel the texture of the bread, the texture of the cheese. So for them, it's an overload of information that comes to them. So you typically find that the way they respond to the world around them is also very different. So these children are not any less children than the neurotypical child. They're just different in the way they experience the environment and the way that they navigate their world. So like I said, autism spectrum disorder is a group of disorders, and this group of disorders basically affects the way we interact socially. So social interactions, and especially language and communication, is like a game of tennis. I give you a signal, you send back a signal, like it leads me to give you another signal. So it's a lot of back and forth. Even the simplest communications, you meet someone on the street and you want to ask them for direction, you first stop, they see you look a little confused, so they respond and smile at you, you smile back, and then ask, where can I find this? And they respond and tell you where to go. So when you do not have that back and forth, it's very difficult for you to have any communication. They also have very restrictive and repetitive patterns of behaviors. Their interests are very narrow, their activities are unusual and repetitive. So they are limited to a very narrow set of things that they like to do or that they feel compelled to do. And they also have unusual responses to the sensory experiences and perceptions that everyone undergoes. So this can either be an overreaction. So small things like light is overwhelming for them. So they also have a very big reaction to that. Or it can be a very muted reaction. So they, for example, some may have no response to a pain stimulus. So if you pinch or prick them with a pin, you get no reaction from them. And also how they respond to sound, to basically the environment around them is not what you and I would have. So under this umbrella of autism spectrum disorders, there are various other disorders, but the autistic disorder or autism is what we often come across. However, how we manage them is different, because the way the children or the young or the adults will, sorry, I keep saying children because I'm a pediatrician, so the people I deal with a lot are the smaller people. But let's not forget that autism is a problem across the life course of an adult. When you develop autism, it's something that you live with for the rest of your life. So the autistic disorder is the commonest disorder, but I shall touch a little bit on how it differs from some of these other conditions. So the challenges that people living with autism tend to experience, one is in social interaction, and usually the very first sign that parents will note is that this child doesn't smile back at them. So for a mother who is playing with her young child, her 4-month-old, 5-month-old, and you're making silly faces and the child basically gives you no response, the child does not give you eye contact when breastfeeding, and already at that point, the mom can tell that there's something wrong. We may not be able to make a diagnosis at that point, but already the mom can tell that there's something that is not right. So their facial expressions, their body postures and gestures is also impaired. They're not able to show you that they're happy, and they're not able to show you with gestures and signs that they want something, or that there's something that's bothering them. and they tend to look like they are in their own world. So they are busy experiencing the world in their mind, and they're not able to show the feelings that they're having inside. They don't have any spontaneous sharing of enjoyment and interest. So if something funny is happening, or for example, if someone tries a magic trick, you'd expect a child to ooh and ah and show that there's something really interesting that is happening. But a child with autism will be excited about it, but will not be able to spontaneously show that. They rarely initiate social interaction, so they will not come up to you and say hello. And contrary to popular belief, they can show signs of attachment, and they can be very close to the people within their immediate environment, their family, and some even get over familiar with people who are not within their family, because they do not have those reflexes that young children get when they know that that is a stranger, and when you try to give me to that stranger, I will scream and cry. They also don't have any inhibitions. So they will say, for those who are verbal, they will say what they are feeling. They will express what they are feeling if they're able to, without any inhibitions. The other area where they get challenges is in verbal and non-verbal communication. About half of them never develop speech, and even those who do develop speech, the speech is not typical to what any other person would have. So they may either have a problem with initiating or sustaining a conversation. So even though they want to tell you something, they won't initiate that conversation, or they may cut short a conversation even though they still have more to contribute to it. You have some who have repetitive use of words. For example, something they have seen on TV, all right, let's go. So you ask him, do you want to go? Do you want to eat? All right, let's go. You tell him, okay, it's time for you to settle down and eat your food. All right, let's go. So they may repeat that endlessly, regardless of whether it's relevant or it's appropriate that time. And they also have a problem with pronouns. So they often substitute I for you. So when they want to tell you, I am hungry, they will often say you are hungry, or vice versa. They may also have an absence of meaningful gestures. So for example, you can see I talk a lot with my hands. So they do not, they sort of have a very unexpressive posture, and also facial expressions. They're not able to show you with their hands to communicate. And especially for children who are nonverbal, having the inability to communicate verbally and non-verbally is very debilitating. So something really intense is happening in your world, and you're not able to talk about it, and you're not able to show that something intensely happy or sad is happening within your world. So that can be a very lonely place to live. They also have some behavior that is not typical, so that's called stereotypic behavior. So this can be repetitive behaviors such as hand wringing. So you may have a child who just constantly wrings their hand. They just hold themselves and rock back and forth endlessly, flapping their hands, constantly spinning, or wherever they go, they are always walking on their toes. They have a preoccupation with certain ideas or objects. So you have some children who think in numbers, and that is all they're able to think about. Others, for example, you have a child who is playing with toys, a little boy playing with a car, and all he can play with is the wheels. So regardless of what kind of car you give him, he only plays with the wheels of the car. He never drives it. He never tries to open the doors. Is not interested in what color this toy is. He's just focusing only on that specific part of the toy. And they may also have very unusual ways of playing with toys. They also have they like to live within very specific routines. So For them, they need to know that after I wake up, I brush my teeth, I wash my face, I have breakfast. So if you wake them up and give them breakfast before they brush their teeth and wash their face, for them it's an extremely distressing thing, because in their mind they know that A leads to B leads to C, so you can never have C coming before B. The way that they sense the world around them can be very intense. And this is sometimes where you also have children who are have a higher functioning can benefit from some of this intense sensation. You've had people with autism who have very keen hearing and are termed musical geniuses because they can hear every single note in a musical piece. And those who have very intense visual perception, so in a very intense pattern, they can pick out a key on a very intensely patterned rug. So the way they see things, they see all the colors, all the patterns, and they have a very unique way of experiencing the world around them. So this can be a little overwhelming for them as well, because the signals that are coming in are a lot. So you may have the way they respond to this can be intense. So you have children who want to look like they're deaf. You talk to them, or there's a car just passing outside the house, and they immediately clap their hands over their ears because that signal is too intense for them. There are children who their sense of smell is heightened. That is the way they tend to explore the world, so they'll sniff everything. A new person comes, they smell them. They smell the object, every object that you give them. For some, it's they experience with their mouth, so whatever is there, they will lick and eat and put everything in their mouth, because that is the way they are able to explore the world around them. There are some who may have heightened sensitivity or reduced sensitivity to touch. So for some, as Njeri was saying, William gets overwhelmed even by just being held. So for some, a hug is like being crushed by a stone. It's a very intense sensation that they're not able to tolerate. And you can have some extremes where even the feel of running water is like putting them under hot coals. So they can't stand the feeling of anything against them, and that may also include clothing. Their play is usually mechanical, it's repetitive, so they may want to, all they want to do is put things in a cup and remove them, put things in a cup, and they can do that for hours on end. They don't have any imaginative play. Like you have children who are pretending to be Superman, others are pretending to cook, so they'll get their little containers and put things and then pretend that is their vegetables. They don't have that kind of imaginative play. They may play with objects that are not usual for children of the same level. So you may find an older child is walking around collecting and playing with shoes, or is obsessed with collecting rocks. There's one mom I had who her first sign that there's something wrong with her child was they could not go anywhere and he does not collect rocks. So if you take him somewhere where he cannot find rocks, he will throw a huge tantrum, and you have to find somewhere where he can find some rocks and fill up his pockets with them. So for them, that is the only place that they can enjoy. Or you have others where you have lining things up. So for them, they won't play with the toys themselves, but they will put everything in a line. You give them food in a plate, they get upset because their food is jumbled up in a pile, and so they have to pick up every single object in that plate and put it in a straight line before they can eat it. Their moods may be inappropriate for the situation or circumstances. So when people are happy, they're there uncontrollably crying or laughing when something sad is happening. And on top of this, some of the other disorders that come in, such as anxiety and depression that are common in people with autism, may also really severely affect the way their mood and the way they respond to feelings. They're often oblivious to hazards, or they may have excessive fear of harmless objects. So when something small happens, they may run for the hills, or you have others who will cross a road without looking right or left. So usually safety is usually a big concern for these children. So in the medical fraternity, how do we diagnose autism? This in the especially the low and middle income countries and African countries is still a big challenge, because while the West already have protocols, the way you go, take your child to the clinic, and they always have their weight checked, their length checked. For them, when a child is 18 months, you have to screen them for autism. When they're 2 years again, you have to screen them again for autism. But we do not have this in our local context. So we often rely on the healthcare workers' ability to notice some of these behaviors and refer the child to a setting where they can have tests done. Most of the tests that are usually done can either be a questionnaire that you ask to the caregiver, and it's sort of a checklist based on a criteria that helps you to identify whether this child has autism, or you can have some play-based tests where you look at how the child responds to the activities that you're doing, and that helps you to tell whether this person has signs of autism or not. Eventually, this child in our setting, sadly, we still have a lot of these children are still labeled under mental disorders. So they are often taken care by the mental health clinicians and physicians. But the movement is trying to get these children back into the pediatric and physician community, where you can have people who actually understand these conditions, and then also are able to care for them in an environment that does not cause stigma, because you'll often have these children being labeled as either retarded or are mentally ill, when they just have a different way of in which the wiring of their brain is being done. So like I said, there isn't a single picture for ASD. All those symptoms that I listed, you can have some, it's a pick and mix. You can have some and not have others. However, there are some other disorders that have a slightly different presentation, so that helps us to identify them differently. For example, Asperger's disorder is usually considered a high functioning form of autism because these individuals tend to be very brilliant. Their IQ is normal and above normal. So they are often brilliant, but their issue is with communication and socialization. So they tend to like activities that are very stringent. So if for them it's about mathematics, that is all they want to do. Day and night, that is all they want to do. And they have problems with communication. For them, they talk at you, not to you. They do not respond to what you're telling them. They only tell you what they're thinking. And they also cannot read facial expressions, emotions. For them, they memorize that when you make this kind of face, that's a sad face. When you make this kind of face, that's a happy face. If there's water on your face, it means you're crying. So that means that you are sad. So that means that probably something wrong has happened. It's not, it does not bring about emotions in them. So this thing, for those who watch movies or series, think the Good Doctor. Then you have the childhood disintegrative disorder, where you have a child who develops perfectly well until they're about 2-3 years, and then suddenly everything starts going back. The potty training that you did, they unlearn. The language that they had disappears, and they can even become mute. And on top of this, now the socialization that was there, the eye contact, all disappears. So you have a child who now has the stereotypic autism disorder, or children with the Rett disorder who they're okay the first 5 or 1.5 years, and then everything starts going back. But also on top of that, their brain stops developing. So these children also have some form of intellectual disability. They're not able to develop any further, and so they basically remain a baby for the rest of their life. And for those, there are those that you cannot even put them in a particular box. So those are the ones that we call the pervasive developmental disorders, not otherwise specified. So there's no pill that you can give to take away autism. It's not curable, but there's treatments and programs that we have that help to improve the symptoms and the complications that come with autism. For example, you have the medications for those who have issues like sleep disorders. Many people with autism have issues with sleep. If they have anxiety, if they have depression, if they have seizures, that can be managed with medications. There are behavior programs that help to basically work on a reward system. So you reward the behavior that is socially acceptable, and you ignore the behaviors that are not. You can also have therapies that aid in development of social and language skills. You can have occupational therapy to try and improve their speech and their language, and also how they respond to sensory and learning how they perceive various sensations. Another big part of this is educational placement and learning programs. So thinking about how you will integrate this child into the learning systems. Do they need a special education program? Can they be integrated into the normal learning programs? For them, school is usually really helpful because that regular program is really helpful for them. But being in an environment where a lot of things are taught with writing and with speech is usually a big challenge for them. So having a school program that understands the needs of people with autism spectrum disorders, such as putting things are either put in pictures, or for those who have issues with talking, you can have them write things down. That is really helpful. So having an education system that understands their needs and is able to meet those needs is very important. Then we have other treatments and therapies, like Mama Will was talking about. Food is a big thing for them. Like I was talking about, many of them have gastrointestinal problems, and that inflammation that comes from that tends to worsen their symptoms. So they often have a special diet that helps to improve their symptoms. You can have other treatments and therapies depending on what challenge they're having at that time. And this includes also therapies and treatments for the parents, because like we said, when your spouse is sick, you're sick. If your child is sick, you're sick. So counseling and care and support groups for parents is also a very big part of this management plan. So as they move around our society, what they really need you to understand is that there's no one size fits all. Different people with autism have different symptoms, and they also have different levels of functioning. They may be a level 1, they may be at level 1 where they need, also called the high functioning, where they just require minimal support. Their issues are just with initiating and maintaining social interaction. While you may have another who is at level 3, where they basically live in their own world. They have very severe issues with verbal and non-verbal communication, and they experience great distress or have very severe difficulty changing actions or focus from one thing to another. But not all things are bad in autism. We have some extremely brilliant and famous people who are on the autism spectrum disorder, and some have even been diagnosed way later. One of the most famous is Albert Einstein. Isaac Newton is also thought to have been autistic. So is Michelangelo. We have Elon Musk has Asperger's syndrome. So you can have, depending on how we integrate these people into society and help them to adjust to their way of thinking, we can actually help them to not only integrate but also thrive in our society. And some of the skills that are special to people with autism are visual skills. They are very visual learners and have very detailed focus. They tend to be very creative and artistic. They have great attention to detail. They tend to be very honest and trustworthy. Because of the way they're able to focus on one thing, they tend to be experts in whatever they tend to focus on. Others have really excellent recall or memory or mathematical skills. They tend to have critical thinking because they are able to see every single part of a problem. So for those who are high functioning, you may actually find that they tend to go into the more complex, technical jobs that require you to be able to think about a single problem in 10 different ways. So in summary, what people with autism want you to know is that everyone is different. Some differences are easy to see, others are less visible, like autism, which is a difference in how the brain works. Autistic people express themselves differently. Some of them don't talk much, others don't talk at all, and some talk all the time. Autistic people can have trouble decoding other people's emotions or trouble expressing their own emotions like other people do. Some autistic people can find it easy to learn very complicated things, or they can have trouble doing very simple things like small talk. They can have intense interests and passions that we may find surprising. They can also have intense fears that we have difficulty in understanding. Autistic people sometimes display behaviors that are unique and surprising, but it doesn't prevent them from having interesting lives and creating beautiful lives. Autistic people deserve to be loved and respected just like everyone else. Thank you.
Yes, thank you very much, Maureen. I think that was a very good summary, and it fits in to, it kind of plays into what Mama Will had said. But what has come up very clearly is the importance of early symptoms and signs. Even the stage of breastfeeding, why is this child not looking at me with the eye contact? And maybe that's a point as parents we should start seeking help. But then the information has to go out to the public, so that if I'm a mother, a first-time mother, and most of the times the subsequent children are very lucky because they're compared to the first one. So-and-so is faster, so-and-so is so-and-so. So the firstborns are really getting a raw deal. But if there was this educative, and that's why this program is important, if there was this educative system where even as a first mother, this is brought up. And maybe one of the other things is the LAME's, the LAME's education. I think most of the time they talk about water bath and they talk this is good food, this is bad food. I think we need to include some of these things, really. I mean, one does not anticipate problems all the time, but it would be very helpful. So it's an education, it's a public education thing, really. And one thing that also comes out, not all of them have epilepsy. A small percentage, in fact, have epilepsy. Most of them are purely okay. And like Maureen said last, and we mentioned this in our earlier talk, that 1% of autistic trait is probably very helpful. It makes you sharpen, it makes you focus, it makes you, and most of these guys who are too good in maths, sometimes when these kids get 490, maybe we should review them and see what element there is. But there's always a silver lining to every problem. It unites family and so on and so forth. the need for proper school programs, like Mama Wynne said, schools are just not, and she's a teacher. I mean, she had everything she could, and yet she didn't get that. What about somebody who cannot even get that close? So I think as a public health issue, as a national issue, as a continental issue, we need to have these schools. It's very disheartening. Sometimes we're in the clinic, you have a patient who has epilepsy, and most likely it was a perinatal issue. And there are a lot of things that go wrong between pregnancy, labor, and the first few hours of life, the perinatal period. So this chap develops epilepsy, and at the age of 8, they are going to school, and you're told, take your child home until they get well. Bring them back to school when they get well. Very disheartening. And yet, you cannot cure all diseases, but you can control. We have hypertension, we have diabetes, we have all these other things, but they can be managed. But it's very disheartening when a school tells a child, a parent, that take your daughter, your son home, akipona, when he gets well, bring them back. And it's really, and you have a child who maybe is slow in learning, but you're told, no, Mitch, your daughter cannot be here. Your daughter needs a special school. And then you take your daughter to this special school, and no, this is not the right place. So again, the schooling system. What is this special school? What's the definition? Who goes to a special school? Because sometimes it's, so I think a lot has come up from Maureen. Now, there are some questions. Maybe I'll start with, are there some supplements, Maureen? We are fond of omega-3 and omega-1 and green tea and grey tea. Are there some supplements which help? Somebody has asked that question.
Well, there's no one size fits all. Just like the symptoms, even the management plan, it really depends on what kind of symptoms they're presenting. But some of the things that have been shown to work generally for everyone is vitamin D, zinc, and probiotics. So usually when you're having supplementation, those are generally the ones that are commonly given to many, because you want to sort of help them reduce the amount of inflammation that is happening in their gut. You want to introduce very good bacteria in their gut, and also things that sort of have been shown to modulate the way your immune system works. So usually it depends on what exactly their associated symptoms are and any other associated complications that they may be having. So it's very difficult to put everyone in one box and say that everyone should get this.
Right, and some of the earlier questions that came are basically on relationships. They get to 14, 15, 16, the girl-boy relationships. So there were a lot of questions which were emailed earlier. How does this affect the relationship, the gender, intergender relationships? Very tricky question,
Yeah,
but I mean, it comes up.
Yeah. Some of the things that probably have been discussed, and this is usually general, when you're having a child who has special needs and has special requirements, you tend to focus a lot on that. So a lot of these other things that other children tend to enjoy, such as sex education, tends to fall by the wayside. So they tend to be very vulnerable to sexual abuse and also abuse of other forms. So they have lower level of knowledge in some of these social things that we tend to teach to other children. Then two, like we talked about how they tend to either have an impairment in the way they're able to show feelings and emotions that can be really detrimental to social relationships and even sexual relationships, because this is where you have the most intense emotional connection to another person. So that can be extremely difficult for them. Then you have the others where you have very intense focus on sexuality. Then you get them now the other extreme where they have pervasive sexual behaviors, such as excessive masturbation, or even they tend to just want to be in that. They have those pervasive thoughts of sex all day, all night. So it can be on either end, but what generally tends to be common for all of them is that reduced education and exposure to sexual education.
Right. And then there are also issues about how do you manage certain aspects? You know, they get depressed, they get anxious, and so on and so forth. But the management is multidisciplinary, and that's probably the best way to go about it. So if there is an autistic child, there is a developmental pediatrician, there's a neurologist, there's a psychologist, there's a counselor, occasionally there's a psychiatrist. So it's a multidisciplinary thing. So that it's not just like Maureen says, it's not a one size fits all. So these are best managed in multidisciplinary teams. And when you sit and discuss them, because like Will, you know, Will needs a neurologist, needs a development pediatrician, needs a psychology counselor, needs a teacher who understands a difficult learner, a slow learner, and so on and so forth. So in the best of systems, these are, you know, like in some diabetic clinics, you go to a diabetic clinic and you have a nutritionist there, you have an orthopodist, whatever there, you have an ophthalmologist. This is the kind of system really that we need for this. So there's a question of how do you manage anxiety, etc. Those are quite multidisciplinary. There's an element here about how do you support. I remember when we started, we talked about if your spouse has Alzheimer's disease. In fact, you're more sick than the spouse because the spouse has no idea what's going on. So there's a question, the spouse actually needs more support, because if I have Alzheimer's, I'm in my own world, you know, but my spouse is really the one who is sick, who is stressed, who is, so you have countries where spouses get, or caregivers they call them, maybe a spouse may not be a spouse, but a caregiver is actually given some time off and somebody chips in and, you know, takes care of this patient who has Alzheimer's disease. So one of the questioners is saying, as a teacher, she works with autistic children, but they get a lot of problems on how to support the parent. Is there a system? How best can this be done? How do you support the caregivers? How do, you know, they can deal with the child, but they see the parents are much more stressed. So what can they do as teachers? This is, I think, must be a teacher. Maureen.
And I think this one I will defer to Mama Will, because as a mom who is actually living through it, she's the one who knows before I answer. And
actually, she's a teacher, so this is ideally.
She's on both ends of that question.
It's a double-edged sword for me, you know, really. But first, Doc, let me say thank you so much for your presentation. And we're sitting here with my husband, just pointing to your slides and saying, yeah, that one we have seen, that one we have seen. Or we're like, we've been struggling with birthing. And when he said adversity to birthing, we were like, okay, maybe there is still that sensory, heightened sense of, his senses. But anyway, I think I've been a teacher for a while, and one thing that having this child has done to me in my career as a teacher is really to cause me to be very aware of my learners and to be empathetic, really to empathize, because I've seen my child struggle to learn. And so when I go to class, I am even now I teach like big guys like Abiero, rising African leaders, you know, the giants of Africa soon. But I still am very careful when I am dealing with them, because sometimes I see they're not refusing to learn, they're struggling to learn. Learning is difficult. And so I think one for me was I think my spouse has been a very great help to me. I have been in spaces where especially the father has had difficulty really coming to terms with the fact that this child, even before we start talking about like autism or any other condition, that first and foremost that this child is not my dream child. And I think it's even harder for them when it is a boy, when it is the male child, because there's so much like expectation. And I remember one of my most heartbreaking moments in my former school was when a father walked, out of a meeting where the educational psychologist was giving us their assessment of these two brothers who are presenting very similar issues. And like he just said, okay, deal with the mom, she'll tell me. And we could see it was heartbreaking. And so I think first for me, education has been very important to me because it has helped me to realize that this is not something which happened because I was careless or I was, I didn't do the right things or whatever, because really I was in Aga Khan. I delivered this baby in Aga Khan hospital. Like, it's the best hospital I could go to in Nairobi, and this happened, and it wasn't anything to do with me or my husband or my family. And like you said, having especially medics who really grounded me and said, you know what, it's hard, but this is it. Let's use all methods that we can. So finding support, number one. I think in school I was able also to support especially parents. And while I'm just a teacher and I'm very aware of my position, I also found help in the wellness departments, like the therapists who we would say, okay, we have to maybe speak to these parents in a certain way. It's a big loss. You can't just call a parent and say your child has special needs. Like, what do you mean? What do you mean my child has special needs? Like, are you saying my child is dumb? Are you saying my child is daft? So having like the psychologist or the therapist speak to them and prepare them for the educational psychologist. I think on that level as parents, that's work that we continuously, I think especially parents who, I'm not saying that I'm not shocked. Sometimes I am shocked. William still has quite, like our latest challenge is around his dental. There's been issues with his dental, structure. It's affecting the way his face is like forming, and we have to now go to an orthodontist who has to reshape the jaw with braces. There are always so many issues that come up that can be discouraging. But I think for me, I really thank God for my spouse and the fact that he has been a very huge support, not even to me, even to my son. Like if you asked William, like mom or dad, he will automatically say dad. Like dad is more understanding. I think I get impatient. He says, oh, mom likes shouting at me, let me just stick with that. That's number one. I think as a teacher then, I have, been more conscious and very aware of my learners and very empathetic. I remember he's going to graduate this year in June. He's now a second year here. And I teach writing and rhetoric in my current school where Abiero goes to school. And this young man came up to me. He's not in my writing class now, but he's in another writing class. And the first thing he said to me, he said, Misan, I just want to tell you that I'm a slow learner. I don't learn like everyone else. People in class, they're always talking. Me, I can't talk, I'm slow. And I really just looked at him. I just felt, why should a child have to explain themselves to me like this? It was just it was a sad moment. And I sat with him and I said, you know what? I'm also new in this school. And so to an extent, I'm also a slow learner. I'm learning slowly. I'm not asking you to give me 100%. I'm just asking you to try. Like when we go to class, just do your best. Whatever you give me, I'll work with it. And I think he's at a very good place. I see him, he's just completed his mock exam. I think being a teacher having William has really changed the way I perceive my learners and perceive my craft. And I've seen that a teacher really can break or make a child in the class. You know, you can help a parent come to terms and understand and say, you know what, there's still hope in this child. At the same time, I can say to my student, you know what, you don't write very well, but 50% or 60% is better than 40%, you know. And yeah, I just like Daktari, like you say, you use a lot of sign language with your little people. For me, I'll tell them a lot of stories and convince them that really there is something that is they can do something, they can change the world in a certain way. So yeah, that's the pedestrian me. Yeah, back to Doc. Yeah.
Thank you very much. So Maureen, as you give your response, there's also a question on the role of cognitive behavior therapy as you comment on what Mama Will has said, or add to what Mama Will has said. Yes, Maureen. Muted. Calvin. Maureen is muted. Hit the button.
She has muted herself, so I cannot really, like, she can try and unmute. Yeah, there we go. Yeah.
Maureen, you have muted yourself.
Thanks.
Yep.
Yeah, no, it's taking a while to unmute, sorry. Yeah, thanks, Mama Will, for that. I think what she said makes perfect sense. The only way I can summarize it is one, education. So educating the parents on what you're seeing in that child. Majority of the referrals that we get in autism come from teachers. The way our healthcare system is set up, when these symptoms are sort of popping up, these children are already out of the healthcare system. So the next person of authority who gets to see them is the teacher. So you being the first point of contact for these parents, being able to educate them about what you're actually seeing is very important, because even if you send them to the pediatrician for care, if you've not laid that groundwork, then they are unlikely to follow up on that referral. Then two is support. This is a parent who knows there's something wrong, like Jerry has said, they're already blaming themselves. So a lot of love, a lot of care, a lot of understanding is what they need. Regarding the cognitive behavioral therapy, just like everything else, it's not a one size fits all. It's basically mainly for those children who have other developmental delays alongside the autism disorder. So it's not generally applied to all children with autism. What tends to be more common is the applied behavioral analysis. So the one I was talking about, where you are sort of promoting the desired behaviors and trying to minimize the behaviors that are not really helping them to integrate socially. But for CBT, it's on a case by case basis. So it's not applied for everyone.
Brilliant. I think time flies. It's 9:30. So I think there's a question on learning material, but I think with the assistance of Maureen, I think Michelle and Calvin can compile some learning material and email to people in the audience. And I think we'll need another meeting like this, not on our Easter weekend. The Easter weekend has chewed a lot of people out.
Yeah.
So I think it's very interesting, and it has flown. This is we are getting into 2 hours, and you don't even feel tired. So I think we'll have to organize one. So maybe we can have some comment. I'll start with Calvin, the businessman. Give us some comments.
I think now you're taking the idea of being a businessman too far. Yeah. Yeah. I think the topic of autism has something that's for a long time been at the periphery of my life. I think it began to surface when I think one of my cousins was diagnosed with autism. I think he did have like a speech impediment when he was younger, and his parents neglected it for I think until he was almost 3 years old. They just thought he's a late bloomer, he's and actually when they had to like take him to a special school, and that's when they told him you have to take him to be checked and like take him to an expert so they can actually like diagnose what might be going on. And now looking at him, I think he's almost 7 right now, and he actually is be able to like function much better than he was when he was 3, because like his parents actually like I think it was hard for them to adjust to that idea, as most parents, it's really like a hard thing to like, it doesn't make you a bad person, it's a hard adjustment to take in. And also the rest of the family, it's like people, I think one thing we fail as a family is not talking about it in terms of how can we support this child who's part of our family, and like support maybe their parents, I think, because they are the ones who like live with the child and provide and support the child. So I feel like that's a big takeaway. And also I want to really appreciate Miss Njeri. I think I was texting Michelle in the chat and saying these are the kind of people who make me want to be a parent, because every other person you hear is talking about how parenting is hard, but these are people who have been given a situation they never thought about or even imagined, but like how they've taken it is just amazing. Yeah.
Thank you very much. Mama Will, situone Baba Will kidogo, aseme hi. Atu wave.
Maybe Ambrose is taking a call. William, Joe, maybe let me show you.
Oh, say hi to William.
William,
just wave and say hi to us. We've talked a lot about it.
Come and say hi. Just wave. Say hello, everyone. Hi.
How are you?
Fine.
You're the star of the show today. We will come to South Africa to say hi to you. If Michelle invites us, send us tickets. Thank you very much, William. You're an inspiration to all of us. Asante sana.
Okay. Okay, Ambrose is coming. Bye, Ambrose.
Good.
Say hi. Just to say hi. So this is my.
Hi, Ambrose. How are you?
I'm fine. I'm very fine. Thank you.
You are an inspiration to Michelle and Calvin, who are non-starters so far. I'm very impressed by what you're doing. Excellent job.
I'm glad to be that kind of inspiration.
Excellent.
Yeah, sure.
Excellent, Ambrose.
Thank you.
Maureen, I know you've been talking 90% of the time. Just one liner, one exit liner.
No, I really appreciate Fmile for, and especially Michelle for organizing this. I really hope that more people get to know about autism and how they can support people living with autism, because as the numbers rise, they likely will outnumber us. So at some point, we will need to be the ones who need to learn how to live in their world. So it's a very important topic, and I really appreciate you for thinking about bringing this out to the public. Thank you.
Excellent. I mean, my take is it's very much underdiagnosed, and like all conditions, like we said in our earlier meeting, sometimes when you make the diagnosis of autism the first time, like medical student syndrome, when they teach about TB, every cough is, oh, I have TB. They taught us about TB. So you can have a situation where there's an overdiagnosis, but there's extreme underdiagnosis. And like we said earlier, not everything can be treated. We can't treat diabetes, we can't treat hypertension, we can't treat epilepsy, but we can manage and control these things. We can't treat HIV, but we can manage and control these things very well. So I think the onus is on us as medics, as educators, to come up with systems where there are support systems which are really reliable, support systems which cut across, where everybody across the board can have some, you have public schools, you have private schools. So we could also have public systems which can accept and support children like this, just as we have private systems. So that was I think I'm very grateful to Michelle and Calvin for organizing this. And it's a bright future, it's a bright future. Michelle, could you kindly summarize and close this? There's an opening and a closing session.
Yes, there is. First off, I would just like to express my sincere gratitude to everyone who joined us today evening, given that it is an Easter Friday. I would also like to express my sincere gratitude to every single panelist. Thank you so much, Dr. Maureen Kinye, for joining us here. Thank you so much, Miss Anne, Jerry Kamau. Thank you so much, Prof. Joey. I know it's very late, especially in Kenya, and even here in South Africa, it's a bit late. So thank you to everyone who joined us from various time zones. I think as we've had this conversation around autism and as we've had this dialogue, and of course the very informative session from Dr. Kinye and Ms. Anne's or Ms. Njeri's perspective, I think the one thing that I have taken away from it is that we need to do more in terms of autism acceptance. As Prof has mentioned, the conditions that do not have a cure, and the chase for a cure leads to issues such as eugenics, where we're trying to create like the perfect child and things of the sort. So of course, let's not be in a rush to go for a cure, but I think it's the issue of management. What does management look like? And management is tailored to various type of people. So like, one may be on one end of the spectrum whereby they have Asperger syndrome, or, they have high functioning autism whereby it may not be as present in their daily life as much, but they still affect them. And then there are those who are on the lower side of the spectrum. So it's an issue of that, we're catering to each person. And there's also a need for people within the healthcare sector to be aware of autism, to be on the lookout for symptoms of autism, because, the minute you're quick to slap a diagnosis on a patient without understanding what is going on, then of course there's issues of misdiagnosis and issues of that. So it's like an issue of ensuring that people out there, it's autism awareness and autism acceptance, and 2, ending the stigma, and 3, also ensuring accessibility in the sense of people with autism can access spaces whereby they do not have to have special schools, and even if they have special schools, whereby they feel catered to and understood and accepted, not cases whereby you have special. I think we've seen this in Kenya a lot, like with the special schools, it's just not catering to the people with various disabilities. So I think it's like an issue of ensuring that they have these spaces whereby they can exist and whereby they can thrive. And it's our job and our duty to ensure that there's as much awareness and acceptance towards autism. And I think, Prof, you have said it best. We need more sessions like this. We need more conversations like this, bringing people even with autism into such conversations. And what does it look like for you as maybe someone with autism to be accepted, to be cared for? So yeah, once more, I am expressing my sincere gratitude. Gratitude to everyone who joined us and to the panelists.
Thank you very much. Maureen, closing prayer. You look like you're very good at praying. Pray for all of us.
Okay. All right. Let us pray. Dear Heavenly Father, we thank you for bringing this group together. Thank you for assisting us to have this very important conversation to help our brothers and sisters who live among us to be able to enjoy the same luxuries and the same spaces that we enjoy. Dear Lord, we pray that you may expand our minds, expand our hearts, that we may be accepting, that we may be loving, that we may be understanding, and that we may seek the knowledge that we require so that we may be able to live with people who may not have the same lifestyles and the same experiences that we do. Thank you for this group that has organized this. Lord, we pray that you may continue to bless them with the kind of reach and the kind of information and knowledge that they wish to expand the minds of those who are around them and those who are across the world. We thank you for the spirit of Easter, and we pray, Lord, that we may continue to be kind to those who are around us. We praise you and we glorify you. For in Jesus' name we do pray. Amen.
Amen. And happy Easter Sunday to everybody.
Happy Easter, and to those who are celebrating Ramadan Mubarak, to everyone who's celebrating, I believe, Jewish Passover, also happy holidays, and to agnostic folks and atheist folks, enjoy your holidays, I guess.
Yeah.
Thank you so much.
Thank you.
Bye-bye, Ambrose, Will, and everybody. See you.
Thank you, everyone.